to be guided by Professor Dr. Hiramat MG, Chief Patron and Founder Secretary of Kasoga. And I should mention that ex-chairman of Breast Committee, Foxy, and the founder of Breast Committee, Kasoga. We also have Dr. Sneha Boyar, a dynamic representation of Foxy last year, with Dr. Nagarathamma of Kasoga, jointly organized a wonderful webinar, and we witnessed it with the theme they did, that is Step Up Breastfeeding, Educate and Support. They did justice to the theme last year, and we continue the theme. Let's make breastfeeding work and work. With this, our board committee chairpersons have coined the title for today's webinar as Challenges in Breastfeeding, with eminent speakers, my guru, mentor, Dr. Suma KB, with a vibrant panelist to debate on making breastfeeding work for everyone, moderated by our chairpersons of Breast Committee, Dr. Lalita, and chairperson of Safe Motherhood Committee, Dr. Shobha, under the leadership of the dynamic president, Dr. Vidya Tovi, and secretary, Dr. Rajeshri Palladi, supported in and also association with Bagalkot OBG Society. With this, I now request Mr. Arun to assist us in inaugurating this virtual platform by playing a video of lighting the lamp. Over to you, Mr. Arun.
आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
Thank you, Mr. Arun. Breastfeeding webinar is officially inaugurated, but I couldn't actually see the video. I don't know about the audience. Is it the same?
It was breaking a bit. Otherwise, the audio.
Okay, so we have officially inaugurated it, but the message conveyed by our fraternity is breastfeeding is a mother's gift to herself, her baby, and Mother Earth. I request the proceedings to be started off with a welcome note by Chairperson of Breast Committee, Dr. Lalita. Over to you, Dr. Lalita.
Yeah.
Dr. Lalita, I should make a mention, this was your second program, and the first program we did was the Public Awareness Walkathon in Mysuru, which was a great success. Congrats to you and your team.
Thank you.
And over to you for the welcome note.
Yeah. Ellargu namaskara. At the outset, I invite everybody to today's webinar on breastfeeding challenges. Breastfeeding Promotion Network of India, which is a branch of World Alliance for Breastfeeding Action, which is a wing of UNICEF, celebrates 1 week in every year, that is 1st to 7th August, with a theme. This year, 2023, the theme is Enabling Breastfeeding, Making a Difference for Working Parents. It explores the importance of systems to protect, promote, and support for breastfeeding in India. Optimal feeding has potential to reduce the burden of undernutrition and overweight in children. Diet-related non-communicable diseases like type 2 diabetes, cardiovascular disease, and some cancers in mother. Over 1 lakh children die every year in India, mainly due to diarrhea and pneumonia, which are preventable. About 90% of women deliver in health facilities, but only 41.8% initiate breastfeeding in the first hour. Enhancing this ratio is a challenging task. Let's find solutions to some of the challenges in today's webinar with eminent speakers and vibrant discussion. I wholeheartedly welcome Dr. MG Hiramat sir, Chief Patron of Kasoga. He founded Breast Committee both at Kasoga and Foxy. And so he can be rightly called as father of breast committee. I welcome you, sir.
Thank you.
I welcome Dr. H. Nagraj, patron of Kasoga. I welcome Dr. Vidya Tobi, president of Kasoga. Because of her encouragement is the result of today's webinar. I welcome you, ma'am.
Namaste.
I welcome Dr. Rajashri Palladi, honorary secretary of Kasoga, who always supports us to such programs. I welcome
Thank
you,
you so
ma'am.
much. Thank you. Namaste.
I welcome Dr. Suman Gaddi, treasurer of Kasoga. I welcome you, ma'am.
Namaste.
I welcome Dr. Sneha Buyar, advisor of Press Committee, Foxy, who is an expert advisor in today's speeches.
Thank you.
I also welcome Dr. Charulata Bapai, chairperson of Foxy Press Committee and advisor to Press Committee, Kasoga. I welcome Dr. Kasturi Donimat, past president of Kasoga and is also advisor to Press Committee, Kasoga. I welcome Dr. Bhakti Rajshekar, president-elect, Kasoga. I welcome Dr. Durga Sasranna, co-opted member and advisor of Press Committee. I welcome Dr. Nagratnama, who is an advisor of Press Committee, Kasoga. I welcome Dr. Sonia Mandapa, who is convener of today's webinar and also is advisor of Press Committee and is my dear friend who always pushes me and encourages me to all my programs. I welcome you, ma'am.
Thank you, ma'am.
I welcome Dr. Basuraj Sajjan, past president. of Kasoga.
ವೆಬಿನಾರ್ ಅಲ್ಲಿ ಇದ್ದೀನಿ ರಾಜಶ್ರೀ 2 ನಿಮಿಷ.
I welcome Dr. Sri Lakshmi KN, website coordinator of Kasoga. I welcome Dr. Shobha Shavi, who is the chairperson of Safe Motherhood Committee. He is the key person in organizing today's webinar. I welcome you, ma'am. I also welcome another key person for today's webinar, Dr. Nagratna Kuntoji, who is president of Bagalkot DG Society. I also welcome all societies, presidents and secretaries of Kasoga. I welcome Dr. Suma KN, who is member of Press Committee and today's main speaker. I also welcome all the panelists of panel discussion, Dr. Vinna Bhatt, Dr. Nagratna Kuntoji, Dr. Jyoti CS, Dr. Hema Patil, Dr. Shweta Chinnanavar. I welcome you all. All Breast Committee and Safe Motherhood Committee members who have supported to this program, I welcome you all. I also welcome Pharmanova company for sponsoring this program. I also welcome all delegates who have attended this program and make it a successful one. Now I request Dr. Sonia Mandapa to take over and proceed with the program.
Okay. Thank you very much, Dr. Lalita.
Thank you.
And we all know that our dynamic president, Dr. Vidya Tobi, who's been the backbone of all the chairpersons and advisors and the EC members and the entire Kasoga family, is initiating and conducting programs. I always call her the queen of nutrition, though this month we are celebrating the nutrition month. She was in Bangalore, then Hubli, and today I think she is in Bijapur, if I'm not wrong. But then she was in Pune last week. She's everywhere. Very enthusiastic and dynamic secretary of Kasoga. Today she is with us in this platform. Thank you, madam. And we seek your blessings, madam. Over to you.
MG Remet sir, I think he's a chief patron. I wish that I seek his blessings for this program. So let him speak first few words and later on I will speak.
I request not to introduce me. Give me 1 minute more. Sonia.
Yes, sir.
Sir, MG Remet sir, please address us.
Yeah, thank you. Good evening, everybody. It's a great
Good evening,
pleasure to be a part of this breast committee program. And you know that I am passionate about this committee. The reason is very simple. As rightly told by Sonia, my guru, Dr. Yashant Daftre, when the elections for the breast committee were happening in Foxy, for 3 years, there was nobody to take the chairperson of breast committee. He suggested me, MG, you take up this committee and work for it. This is the future committee, which is the need of the hour, he told me. So I took up this committee. In those days, there was no election like this, committee election. Now, this has become so important. And after taking that, I moved all over India and motivated so many people. In fact, I conducted 40 workshops at various places in India. And what I found was that there is so much for OBGYN to do in breast committee. One thing which I would like to address is that all our women who are dying, number one cause of death is breast disease, that is cancer of breast. And unfortunately, they are all going to the surgeon in stage 4. And if you detect a cancer of the breast in stage 0 and stage 1, and if you treat it properly, they are almost, it can be declared as no, they are no cancer at all. And all these reasons, you know, that why people will get cancer, it is one of the most important is the breastfeeding. A woman who feeds breast and a woman who regularly feeds breast, her incidence of cancer is very, very less. And you know, there are many advantages of breastfeeding. I do not want to take that time because today's topic is a very interesting, a practical topic, challenges in breastfeeding. My colleagues here are all women. I think they have got more knowledge and more experience of the problem of this. And we have seen many a times that woman will struggle to feed her breast, feed her child. I think a proper knowledge of breastfeeding and a proper demonstration how to feed the breast. That is the reason that 1 week program has been kept in the month of August. That is from 1st to 7th breastfeeding week. And today we have got excellent speakers and they will be able to tell us what are the challenges in the breastfeeding and how to overcome them. And by overcoming the challenges, how best a child can have the milk and how best the child can grow. And it is the early growth of the child in the first 1 year is equal to next 99 years growth. Whatever the child gains in that 1 year is the basic gain, both in nutrition and strength. I think this is a very important topic they are going to discuss. Without taking much time, I wish a grand success to this program and more so to Dr. Lalita. You know, Lalita is one of the favorite postgraduate student. And I insisted her that you take up this has got more public relation and you are a very good public contact person. Rightly, she conducted the first program so successfully. And I wish that today also it will be a very successful program. Thank you very much for inviting me to this program. And Dr. Bhovyar and Dr. Charulata, who have become the masters of breast diseases. And they have taken this committee to such a great height, especially the Sneha, who worked so much relentlessly, 24/7 and 365 days. Even Charulata is also working like that. And Nagaratnama madam in our Kasoga last year, she did so wonderful. And I will definitely, I will say that Dr. Lalita will do. With best wishes to Lalita and her committee, and even the another committee which has joined today, they are doing excellent work of Vistrut program. I think both have joined hands and I wish them Shobha also a grand success. Thank you very much.
Thank you, sir. Gurubhyo Namaha. One day before, sir.
No, Guru is always Guru. Daily you should go down in front
Yes,
of
ma'am.
Guru. Yes.
ma'am.
Yes.
Thank you so much, sir. Dr. Vidya ma'am, we would like to hear from you, the pearls of wisdom.
Yes, ma'am.
Yeah. Thank you, Sonia. Thank you, Sonia. And congratulations, my hearty congratulations for that wonderful public forum, which the breast committee did in Mysuru.
Yes.
So congratulations. And I must congratulate for this program. It was a really challenging job. it was getting postponed, and ultimately it happened today. So I congratulate Safe Motherhood Committee as well as Breast Committee of Kasoga. And really, it is a very good program. You brought in all the stalwarts of Kasoga over here.
Yes, ma'am.
And we all know the importance of breastfeeding. It cannot be overemphasized. We know the barriers to the breastfeeding as well. Maybe it is a socioeconomic status or lack of education, some misconceptions or various social norms. We all know that low income women have lower rates of breastfeeding if you do the survey. And even in the urban population also, there are so many misconceptions about the breastfeeding. And low income group, they are likely to go to various, excuse me 1 minute, I'll just close down. So we just know that they cannot do any, means they have to go for their employment, they go at various places. So it is very difficult for these women to breastfeed. So in the higher income women also, they have got their misconceptions. The benefits also are to be, we all know about the benefits. Every year in August month, we go on talking of breastfeeding. I think 24/7 and 365 days, we must talk about this breastfeeding to increase the awareness as well as increase the incidence, and make breastfeeding awareness month every day. So as Lalita pointed out, not only breastfeeding decreases the various child infections like diarrhea, ear infection, all those things. But also I must tell, as Sonia was talking about the nutrition, the breastfeeding also decreases the rate of childhood obesity who were breastfed as infants. Second one is decreased rate of various non-communicable diseases. We were, means our Foxy president tells about Badlao. Then the infants, if you are breastfeeding them, even mothers, they are having decreased rate of hypertension, hyperlipidemia, diabetes, and cardiovascular diseases in these women who breastfed their infants. Of course, Dr. M.G. Hiremat pointed out about the breast cancer. There is a decreased rate of ovarian and breast cancer in women who breastfed their infants. And most important is increased bonding between mother and infant. There is lower risk of postpartum depression. So perinatal depression also decreases with whenever the breastfeeding is done. It is the most important benefit of breastfeeding. I must say that milk is well established as a best source of nutrition for newborn and infants, and it has got many maternal, infant, and social benefits. So with this, I conclude, and I heartily congratulate both the committees, and I want more committees to join. 2-3 committees, they can take a common topic and do such programs which are very, very useful. Congratulations, Lalita, Shobha, and all the panelists, and especially my friends Neha and Charu. Both of they are doing excellent work. They have done excellent work, and we expect more work from them. So thank you for joining all the speakers, and I'm listening to this very wonderful webinar, which is going to happen now. Thank you very much.
Thank you very much, madam, for your wonderful conveying message. And now we have an enthusiastic, dynamic secretary of Kasoga, Dr. Rajeshri Palladi. Madam has been very supportive with her knowledge and inputs, and she will be chairing the first session. And madam, I request yourself to introduce Dr. Suma KB, the speaker of the day, to this virtual platform.
Namaskara ellarigu. After the full words of input from respected Hiremat sir and Vidya Tobi ma'am, we are quite looking forward to the speakers who are going to give us more inputs about this topic, which is as natural as mankind, as happening from the first childbirth, but still we keep talking about it, maybe because of the wrong messages which are carried by the industrial makers, and somehow in the past 1 or 2 centuries, maybe in the past half century, we have lost the art of natural childcare, that is breastfeeding. And can I have the slide or the introductory slide of the first speaker. It's actually a very enigmatic thing that we keep talking of breastfeeding, because what is so unnatural about it? It's so natural, but every year we have to reinforce ourselves for this. It is my proud privilege to introduce Dr. Suma, who is a professor and unit chief of Department of OBGYN, JSS Medical College and Hospital, Mysuru, undergraduate and postgraduate from JSS Medical College, PGD MLSL from Symbiosis University, Pune, member and governing body and college council of the JSS Medical College, member of UG and PG of the JSS Aher, active member of Mysore OBG Society, and her area of interest is high-risk pregnancy. I'm sure Dr. Suma is going to give us a wonderful talk and enlighten us more about this topic. Over to you, Dr. Suma.
Thank you, madam. Let me share my screen.
Madam, you can make it full screen.
I'm making.
Yes, madam.
Yes, ma'am.
Good evening, one and all. Respected teachers in the webinar who are all present today. Happy Teachers Day in advance to all my teachers. I bring greeting from JSS Medical College, Mysore. And today I'll be speaking about breastfeeding and contraception. Why we should know about breastfeeding and contraception, and why that point need to be stressed too much. There is a concern about inadequate postpartum contraception around the world, which accounts for increase in the incidence of induced abortions, especially 6 to 8 months after the delivery, maybe due to suboptimal contraceptive advice after the delivery. Then why we should stress on postpartum contraception? We all know it is a psychological stress. It has got adverse perinatal outcome, and also it is also not that women is not without risk, because there is always an associated maternal health risk. And we all know that most of the time the sexual activity returns within 6 weeks after the delivery. And we should also know that the return of ovulation, especially in non-breastfeeding women, it is about 4 weeks. And in breastfeeding women, it is almost, they say that it is between 33.6 weeks with a range of 14 to 1 weeks. And menstruation will return on an average of 28.4 weeks with a range between 15 to 48 weeks. In breastfeeding women, the lactation serves as a contraceptive method up to 6 months, wherein it is called as lactational amenorrhea method. And WHO provides recommendations on contraception for women who are breastfeeding to facilitate safe and effective contraceptive use. What should a clinician should assess when considering contraception for a breastfeeding woman? We all should assess a woman's postpartum contraceptive needs by taking into account of her personal choice, sexual activity, breastfeeding pattern, whether how frequently she is feeding, whether it is on-demand feeding, whether more stress should be given with the night feeding, the return of menstruation, and is she having any medical problem like diabetes or hypertension, which complicated the pregnancy also. And any associated social factors like whether she need to attend to her work within short time or not, all those things should be assessed by the clinician. And women should be given information about all hormonal and also non-hormonal contraceptive methods, and should be offered information and support to use their chosen method of contraception more effectively. What are the effects of breastfeeding on ovulation and fertility? As I have told earlier only, women should be advised that breastfeeding delays the return of ovulation. And of course, we also should stress that all contraceptive methods have low failure rates when used consistently and correctly. Women should be informed that avoiding the onset of menstruation before starting contraception, it is not advised, as it might put them at risk of unintended pregnancy. What do women need to know about their contraceptive choices? Mainly with the efficacy, effect on breast milk or infant growth, because most of them will have the doubt that any method which they adopt for contraception might decrease the volume of the breast milk. I'll be dealing that with each and every method of contraceptive method which is advocated for any women. The first and foremost thing would be the lactational amenorrhea method, wherein the women are advised that if they are less than 6 months postpartum and they are amenorrheic and they are fully breastfeeding, the LAM is over 98% effective in preventing the pregnancy. And they should be advised that the risk of pregnancy is increased if the breastfeeding decreases, especially if she stops feeding the baby at night. And here I would like to stress a few words about the definition of breastfeeding, like what is the meaning of full breastfeeding and partial or token breastfeeding. Full breastfeeding feeding means it should be exclusive. And another thing is, of course, as I have told earlier, women should be amenorrheic and it should be less than 6 months. And we should keep in mind that there should not be longer interval between the feeds, especially not more than 4 hours during daytime and more than 6 hours at night. With this, the effective efficacy of contraception is 98%, and cumulative pregnancy rate is to the extent of 0.9 to 1.2%. And with the partial or token breastfeeding, it has got less impact, reducing to little impact on fertility. The factors which may precipitate the return of fertility are reducing the frequency of breastfeeding, stopping the night feed, or when the baby sleeps through the night, separation from the baby, especially when she returns to her work, introducing the supplements, that including extra drinks of fruit juice or even small amount of solid foods, and anxiety, stress, or illness, either in the mother or in the infant or in both. Coming to the hormonal contraception, women should be informed that the level of hormone in the breast milk when using a hormonal method of contraception is comparable to the levels observed when they have an ovulatory cycle. Women should be advised that the available evidence is unable to prove if hormonal contraception has any effect on volume of breast milk. And also that the available evidence indicates that hormonal contraception has no adverse effect on infant growth. We should always stress that it doesn't have any effect on the volume of the milk and also the infant growth. Coming to the combined hormonal contraception, the women should be advised that use of COCs in the first 6 weeks postpartum may have an adverse effect on volume of breast milk, and women should be avoiding COCs in the first 6 weeks postpartum, and COC can be used without restriction from 6 months postpartum. And if COC is not recommended between 6 weeks and 6 months postpartum. However, if breastfeeding is established and COC may be considered if other contraceptive methods are not acceptable. Coming to progesterone-only contraception, women should be advised that the use of progesterone-only methods in the first 6 weeks postpartum does not appear to have any adverse effect on breast milk volume. And progesterone-only methods provide almost 99% efficacy. And the problematic bleeding which is associated with the POPs, they appear to be more acceptable than experienced by the women who are not breastfeeding. And after counseling, breastfeeding women may choose to use the progesterone-only method of contraception before 6 weeks postpartum if other contraceptive methods are not acceptable. Coming to IUDs, suppose if that IUD is not inserted within first 48 hours postpartum, it can be delayed until 4 weeks where we can achieve involution of uterus. And of course, IUDs do not have any effect on breast milk, and the expulsion rate is very low to the extent of 1 in 20, and the low rate of discontinuation will be there whenever it is inserted between 4 and 9 weeks postpartum. Coming to the barrier methods, women can be advised that the use of diaphragm or the cervical caps, they can be delayed until involution is complete, and condoms and spermicides can be used without restriction before or even after 6 weeks postpartum. And one should caution the women that the fertility awareness methods should be told to her while breastfeeding, even when the menstruation returns. Coming to the sterilization, RCOG says that it should be advocated after an appropriate interval following delivery. Suppose if it is requested in the immediate postpartum period, especially concurrent with the cesarean section, it should be made aware of the increased regret rate and also the failure rate. Coming to the clinical effectiveness unit, that is CEU of the WHO guidance on contraceptive starting regimens for the breastfeeding women, LAM can be advised to be started immediately after immediately in the postpartum period, and COCs, actually, as I have told, it is better women is if it is 6 weeks postpartum, it can be started, but as much as possible, better to be avoided within 6 weeks to 6 months. But if it is started within 6 weeks, additional contraceptive protection is required for 7 days. But if the woman is more than 6 weeks postpartum and having regular menstrual cycles, it can be started as for non-breastfeeding women. And POP, they say that the guideline says that it need not be given within 21 days. It can be given, but if it is started within 21 days postpartum, additional contraceptive protection is not required. And it can be given whenever we are very sure that she is not pregnant. Of course, the question of pregnancy within 21 days is not there. But if it is beyond 21 days, additional contraceptive protection is required. And it should be informed that we should always say that there are some medications or the company progesterone tablets which we are giving to the pregnant women, the company might not advocate the usage of that if it is before 6 weeks. We have to tell about the product license for usage of some contraceptive pills. Coming to the progesterone injectables, breastfeeding women should be advised that, especially we always promote DMPA injections. Before 6 weeks delivery, before 6 weeks after delivery, it is usually not recommended. And then it is associated with troublesome bleeding, especially when it is used in the early postpartum period. And if she chooses DMPA, it will not be required within 21 days. But if the risk of immediate subsequent pregnancy is very high, there is nothing wrong in giving it within 21 days postpartum also. And of course, we should always tell about the product license when it is used before 6 weeks. And coming to the implants, the women may choose to use progesterone only implants before day 28 without the need for additional contraceptive protection. And LNG IUS, of course, it can be inserted 4 weeks postpartum. And as I have told earlier, IUDs can be inserted within 48 hours. And if it is not inserted within 48 hours, it can be delayed up to 4 weeks. What they say is, if it is inserted in that period, the chances of perforation is more. And of course, usage of condoms and spermicides. The women can be advised that the usage of these things can be delayed until uterine involution is complete. And female sterilization can be performed at the time of cesarean section, of course, with appropriate counseling and consent. And of course, male sterilization and female sterilization can be considered after appropriate interval following delivery. So does breastfeeding women require emergency contraception? Of course, yes. They can be advised that unprotected sexual intercourse or contraceptive failure before day 21 postpartum is not an indication for emergency contraception, because within 21 days, chances of pregnancy is very much remote, we all know. And breastfeeding women can be advised that once hormonal contraception has been initiated, potential contraceptive failures should be managed in the same way as for women who is not breastfeeding. And breastfeeding women may be offered an IUD as an emergency contraception from 4 weeks postpartum. Do we have to follow up these women after advising contraception? Of course, yes. Breastfeeding women should be advised to return at any time to discuss side effects or any other problems which she encounters with any method of contraception at any period of time. And this is the WHO advocated CEU guidance, where we can what is the different period of different periods after the delivery, we can advocate different methods of contraception. So postpartum, immediately we can go for LAM IUD, condoms and spermicides, and also, of course, female sterilization along with LSES. And up to 4 weeks, we can go for POP, implants, and also emergency contraception if at all, if it has happened. And 4 to 6 weeks, we can think about IUD, and we can also think about LNG IUS. And 6 weeks beyond, we can go for either progesterone injectables, combined OC pills, and of course, we can advise barrier methods and of course, sterilization also with appropriate timing. And this is in short about the typical and the failure rate or the pregnancy rate with the typical use and perfect use. And of course, I know all of you will know what is the typical use and perfect use, because any contraceptive method, we should always advise the couple mainly that it should be the perfect use, because whatever is the duration or whatever we have advised, that should be used. There is nothing like when, especially with the COCs, whenever women remembers to take the tablet, she should take. It is not like that. That comes under typical use. Perfect use means the cycle, like once in 24 hours, exactly she should take the tablet. She should never forget. All those things should be stressed. And if that perfect use is there, the contraceptive efficacy is very good. And this is Academy of Breastfeeding. They have advocated the different family planning during lactation, minimizing the physiological impact on breastfeeding. And according to them, the first choice methods are LEM, natural family planning methods, barriers, and IUDs. And second choice would be progestin only methods. And third choice comes with the COCs. And this is the chart which I have, this is the in short about whatever I have described till now, the chart showing different contraceptive methods that can be advised to the postpartum women as per the WHO guidelines. So this is in short, this is a diagrammatic representation. And of course, all women can be advised IUD, sterilization, and also condoms. See, as I have told earlier, the condoms and spermicides can be advocated within immediately after delivery, suppose if there is sexual contact. Otherwise, IUDs can be inserted after before 48 hours and after 4 weeks. And same thing with sterilization with appropriate timing. And emergency contraception most of the time after 4 weeks. Lactational amenorrhea method, of course, up to 6 months after delivery. And after that, we can go for either POPs or combined hormonal methods. And of course, if the women is not breastfeeding, we should always keep in mind, we can start immediately the POPs or after 3 to 4 weeks, because we know that ovulation will return within 4 weeks, we can advocate combined OC pills. So these are my references. Thank you for your patient hearing. Again, I would like to thank the Dr. Lalita, Chairman of Breast Committee, and also Dr. Sonia Mandapa, and also Hiremat Sir and Vidya Madam for giving me this opportunity. Thank you very much.
Thank you, Dr. Suma, for this crisp and clean presentation. I think you have covered most of the topics of the concerns of contraception that we need to take during the breastfeeding time. And very neatly and nicely it has been put up as to what should be the choices of contraception during the breastfeeding.
Thank you, madam. Thank you.
Yeah, thank you so much.
Okay. Thank you, Dr. Rajeshri and Dr. Suma madam. Shall we take up the questions at the end of the session?
Okay, no problem.
Yeah, I think there are questions as of now.
Yes. Okay. But then I think I should quote this, a good education can change everyone. A good teacher can change everything. So is it with my teacher, Dr. Suma KB. I know it's her teaching is her passion, and we all have been witnessing this. And now I'm sure the participants also have witnessed this crisp and very clear presentation. Thank you very much, madam. Moving ahead, it's a proud privilege for us on board today that we have Dr. Sneha Buyar, who wrote the committee last year and created awareness programs from our own fraternity and for our own consultants and also to the public. She also hoisted the breast committee Foxy flag so high, roping in Kasoga breast committee too with Dr. Nagaratnama. And she will be today gracing this webinar as an expert for panel discussion. Next. for which Dr. Suman Reddy and Dr. Nagratna will also chair the session. I now request Dr. Nagratnama to introduce Dr. Sneha Buyar to our esteemed audience. Over to you, Madam Dr. Nagratnama.
Yeah, good evening, everyone. At the outset, let me thank the Kasoga Committee, Foxy, Kasoga for giving me an opportunity to chair the session. It's my honor to introduce Dr. Sneha Buyar, who is really, as it was told, Foxy Breast Committee Chairman last term. She really did a wonderful job, and I was a South Zone coordinator for that committee. So it was really wonderful, and we did a lot, I must say, because we covered nook and corner of the India to create an awareness, both physically as well as through webinars. And in that, even Karnataka took part, and we did a wonderful job. So she was a Foxy Breast Committee chairperson during 1921, and she is also Governing Council Chairman of ICOG 21-22. And amongst MD Chair 22-24, and she is also a Suffolk Working Group member and a founder president of Vidarbha ISOPAB. She has international lot of awards to her credit. Among that is the International MS Signature Award for the phenomenal work she did during 2020. And also Asia GEC Award 2021, and Dr. S.N. Malhotra Individual National Award for contemplating work in rural obstetrics in 2008. And also Dr. Durusha Award for National Individual Award in 2022. And Dr. Ambubhai Joshi State Award by Government of Maharashtra, and also the Lakshmi Halekar Excellence Award. And she has a vast experience of 30 years in OB-GYN as a clinician as well as an academician. And she has a lot of publications. And I think last year our Kasoga members are very familiar with Sneha, because she attended, she was also expert in my committee, and she did almost whenever we do any webinar, she would be present in that webinar. So over to you, Sneha, and welcome you to Karnataka webinar thing.
Thank you so much. It's my pleasure to be here with Kasoga always. Over to you, Dr. Sonia. Yes, I'll be making some comments whenever we are discussing.
Thank you, Madam. Moving ahead, to moderate this panel, I request the chairpersons of both the committees, Lalita from the Breast Committee and Dr. Shobha from Safe Motherhood Committee. I'm sure Dr. Lalita would be continuing the committee activities in lineage with how Dr. Nagratnama did so last year. And may I now request Dr. Lalita to kindly introduce Dr. Nagratnama to this audience.
Thank you, Sonia ma'am. Dr. R. Nagratnama is MBBS MD, FICSA, FICOG, FKCOG. She is professor and former HOD of Department of OBG, Rajarajeshwari Medical College and Hospital, Bangalore. She was president of BSOG in 2019 and 20. She was chairperson of Breast Committee 2020 and 23. South Zone Coordinator Breast Committee, Foxy 2020-2023. She was member of Foxy Breast Committee 2020-2023 and advisor of Kasoga Breast Committee 2020-2023. She is EC member of KSA AGOI 2022-2024. Has many awards and experience for more than 35 years. I welcome you, ma'am, to chair the session.
Okay, thank you, Arun sir, for muting. May I now request Dr. Shobha Shavi to introduce chair. Dr. Suman Gaddi, Treasurer of Kasoga, to this August gathering.
Yes, madam. Ellargu namaskara. Shubha Sanjay. We are just, it's a day just before Teachers' Day. And I would like to first take this opportunity to thank all my teachers, starting from Dr. M.G. Hiremat sir, to all the teachers who have made me who I am today. Thank you, Sonia madam, for giving me this opportunity. Dr. Suman S. Gaddi is the ever-smiling treasurer of Kasoga. She is professor and HOD of OBG WIMS Ballari. She has a teaching experience of 27 years. Kasoga EC member North Zone in 21-23, organizing chairperson of Kasoga 2019 conference held at Ballari, past president of Box 2011 to 13. She bagged the best president rotating trophy and the Durusha trophy during the ACOG Mumbai. A number of publications in national and international journals. She has presented many papers and bagged prize for best presentation. She is a principal investigator and facility lead for international research project, and our area of interest is preventive oncology and high-risk pregnancy. I
Thank you,
welcome.
Dr. Shobha, for the short and sweet CV. Thank you.
I think not wasting much of the time, both moderators, I think you should take the lead, and we are all waiting for the panelists to voice out. Over to you, Dr. Lalita and Dr. Shobha.
Shall I start sharing, madam?
Yeah. Can you please introduce
No,
the panel?
let us first introduce our panelists
Yes.
one by one, so that if their CV is reflected, that
Yeah,
will be.
Yes, madam.
First, Dr. Nagaratna. Okay. Dr. Joshi.
You want Nagratna Kuntoji, madam? I'll put madam.
Yeah. Dr. Nagaratna Kuntoji. She is MBBS MD, Professor of OBG, SNMC Bagalkot, present President of Bagalkot OBG Society and past Secretary of Bagalkot OBG Society, Organizing Secretary of Kasoga 2018, Chairperson of National and International Conferences. Her areas of interest: high-risk pregnancy, fetal medicine, and social obstetrics. I request you to take a chair in the panel, ma'am. Next is Dr. Jyoti. Dr. Jyoti GS, MBBS MD, PGDMLE, FICOG, FICMCH, Professor in the Department of OBG, Ramaya Medical College Hospital. Vice President, BSOG, 2021-22, Secretary of BSOG, 18 to 19, Organizing Committee Member of AICOG, 2019, Member of Food and Drug Committee of FOXI, 2018 to 24, has 41 publications, authored 1 book and 1 manual. Is a member of various committees, has been in the organizing committee, faculty, and speaker of several CMAs. I welcome you, madam, for the panel discussion. And Dr. Hema Patil. Dr. Hema Patil is MBBS and DGO, practicing for the past 20 years at Patil Maternity and Children's Hospital, Rani Bennur. I welcome you, madam, to take part in panel discussion. Over to you, Dr. Shobha, to introduce other panelists also.
Thank you, madam. Thank you for agreeing to work with our Safe Motherhood Committee. And we have been preparing very nicely for this panel discussion, me and madam, since a week. Now I welcome our next panelist, Dr. Veena S. Bhatt, madam, who is practicing in Bhadravati since 28 years. She was president of IMA Bhadravati 2019 to 2021. FOXI Public Awareness Committee representative of SOX from 21 to 23, Chairman PCPNDT, Shimoga District, Health Advisor to Women's Commission, at present representing Breast Committee of Shimoga, winner of FOXI late Dr. S.N. Malhotra Appreciation Award in 2015, JSSMC Best Alumni Award in 2019, winner of other awards like Shrestha Vaidya Sahiti by IMA Writer Association in 2017, and she has won various awards for her extensive social work. and she's a voracious reader and a great writer. She writes in many columns of popular newspapers. She has also written many books. She conducts many workshops and also yoga classes for women. And we are lucky to have you on the board, madam. I welcome you to the panel. And our next panelist is the youngest from Bagalkot, Dr. Shweta Chillananavar. She is the member of Safe Motherhood Committee. She has done her MBBS from Hubli, MS from MMC Mysuru, done her hospital administration from Acharya University. She has done fellowship in infertility. Her field of interest are infertility, recurrent pregnancy loss, and high-risk obstetrics. I welcome you, Shweta, to the webinar. So, shall we start, Lalita, madam?
Yes, ma'am. We'll go ahead with the case one. Yes, ma'am.
Okay. So, to begin with, we have a case. For first case is that of Mrs. Sanjana. She is an IT professional. She's a primary with 26 weeks of gestation. She's living with her husband, no elders at home. Recently, her friend delivered and she was not able to breastfeed her baby. So, listening to that, Sanjana has become very anxious. She has Googled a lot about it, but still she's not convinced. She has read Veena but madam's column in a popular newspaper, so she thinks she can help her and she wants guidance. So, Dr. Veena Bhatt madam, so
Yes,
how would you like to help this lady, Mrs. Sanjana, who is so anxious about lactational failure, and how she can improve her chances of having a very good breastfeeding experience?
Thank you, Dr. Shobha, and good evening all. My teachers are there, Dr. M.D. Hiremat, and all senior members, FOXY members. My pranamas to everyone. As already told by Dr. Shobha, the pregnant lady is software engineer in her second trimester. And it is almost at the end of second trimester, 26 weeks. And it is very much known that
Getting some network issues.
yeah, it's raining here.
Okay, ma'am.
Okay, okay. Go ahead, madam. We can hear
Can
you.
you hear? Okay.
Yeah, you can switch off your video, then some amount
Yeah.
of work will be corrected.
Okay. Actually, it is raining and heavy thunder and all that. So you can hear, no? Okay.
Yes,
Yeah,
madam.
we can hear.
Better you
Please
switch
go
off
ahead,
your-
madam.
Yes,
We can
yes.
hear you.
Okay. So with the proper support from we doctors and health workers and also husband and family, actually women can adhere to nutrition and breast practices very well. And it is a most sensitive and receptive period, the third trimester. So we have to guide her properly, and the 1,000 days of window opportunity, we should make use of it properly. And I will switch off the video.
Correct, madam. That is better, madam.
Okay. And then what we should try to allay her the apprehension. What happened with her friend? Actually, we should inquire. And with each visit, we should try to allay her apprehension about the breastfeeding. And exclusive breastfeeding, how for 6 months, not even water, not any prelactal feeds, everything we have to counsel her. Actually, and about the baby friendly hospital, everybody should practice. And what I have done is I have printed everything in my this antenatal book only. What are the rules of baby friendly hospital? And I will make them to read. And even WhatsApp group also I will make for antenatal pregnant woman. And they ask all the questions. So everyone should try to follow that. And we have to tell her that for any problem with her breast, like any flat nipple, any inverted nipple, or any type dimple type of nipple, bifurcated nipple, and we should try to do the pinch test also, where just 2 centimeter from the nipple. I should try it, whether it is pseudo inversion or real inversion. All that we have to take her into confidence and try to solve her problems. And we should always counsel her. And about if it is inverted nipple and all that, we should try to use that syringe method or nipple puller. And massaging regularly during bath, it is controversial. Sometimes it may stimulate oxytocin and stimulate preterm labor and all. There is a discussion. I think I used to tell all the women in my antenatal counseling classes, which I conduct every month. But nowadays I tell only if there is necessary, you do that. Otherwise, there may be some stimulation of hormones and preterm labor, and I think the seniors should guide me regarding that. And we should suggest all the any problem if there is encountered, we should try to solve that. And all health workers also should be educated. And we should make the opportunity even during because it's said that she has no elders at home. So even during pre-labor period, all the whoever attender comes and our staff members only, we have to educate. And even after delivery, immediately before clamping, if it is normal delivery, early initiation of breastfeeding is very, very, very important. How it is important, we should counsel her, how it benefits her, like avoiding breast cancer and avoiding obesity and further lifestyle diseases in mother. And even in the baby also, how it improves, avoids respiratory infection, gastrointestinal infection, and all, as well as how, and in about IQ also you should tell how the breastfed babies are more intelligent. Then the mothers will start doing that. Instead of telling all the infections, nowadays, what I tell is, you join tuition, no need of joining tuition. You breastfeed the baby exclusive for 6 months, and then 2 years, your babies will become intelligent and get all seeds, whatever they need. Yeah, then that will be very effective counseling. And about nutrition, what to eat, the quality is important, not than the quantity. Which 300 calories more during pregnancy and 500 calories during lactation. Everything you should consider.
Okay, madam. Madam, do you suggest any good books which can help in breastfeeding?
Yeah, that's what I told. No, actually, I have printed mine only. I will show them and I will give them. And very good books and WhatsApp group, I told, no, better to add. And like a book written by Dr. Asha Benkappa in Kannada. And other, even what I read during my pregnancy, Dr. R.K. Anand's book I read. Actually, there are so many materials you can suggest only instead of Googling and this thing. There are so many. And Foxy's, we are trying to get the booklets also according to Dr. Shobha had told me also. Thank you.
Thank you, madam. Dr. Lalita, madam.
Yeah, we have BPNI books also regarding the breastfeeding, and there are many videos also. Even through breast committee, we are still planning whether we can bring out certain videos which will give them basic information about breastfeeding. They're looking at them, they should feel that they should start feeding. They should have that joy of motherhood. This is what we are trying to do. Once it materializes, we'll send it to all societies and to the pregnant woman at the 3rd trimester. I think that also helps make use of the media as well.
Okay.
Yeah, now the case 2.
Here, can I interrupt Lalita here?
Yes, ma'am.
Yeah, I think you can ask Dr. Sneha, because we had done during my tenure when she was this thing, we had done a video on breastfeeding for training nurses. So in that, the whole information has been given. She has done in all languages, and Kannada version I have done.
Yes.
So I think she can throw a light on that. And also we released a book along with this one, Savitri, our public awareness committee in our time in Kannada regarding the breastfeeding booklet we have released, and we have given to all the societies.
Yes, ma'am. I'll fetch
Myself
it.
and Savitri, we had done.
So,
that. And now
thank
video
you,
is
Dr.
there with,
Nagaratnama. Thank you. In fact, thank you for the opportunity to share. I would just like to summarize what Dr. Veena has said. she has very beautifully expressed it, how you have to, when the lady is coming to you for antenatal care, you have to prepare her for breastfeeding physically as well as mentally. So physical fitness, her own health wise. So considering her diet, her plenty of fluids, fruit juices, and what not to drink, like energy drinks and all these things. What food she has to have, healthy food, right from the caloric requirement, the daily recommendations, and what appropriate superfood she should have, to the examination, what she very aptly described, right from the size of the breast doesn't matter. Even a smallest size of functioning breast can produce milk. So many of these women, they have their myths, that because the breast is small, she won't be able to breastfeed her baby. So a smaller size of functioning breast should be sufficient to produce milk, and all those things we have to explain. Whether it's a small flat nipple, inverted nipple, it does not interfere with breastfeeding, because when you are talking about the latch or the proper attachment of the baby for breastfeeding, it is about the, the baby latches to the breast and not to the nipple. So in fact, we have to allay their anxiety that even if you have a flat nipple or a retracted nipple, there's no need for even stimulation, manual, correction as well. So even when you examine these women, don't make them anxious. You just notify in your case paper. Maybe later on you can just help them with manual correction and syringing, whatever you want to do. So that is one. So physically, she should be prepared for breastfeeding. At the same time, mentally, she should be prepared that yes, feeding the baby is a pleasure. It should be a joy, a joyful experience to the mother. It shouldn't be a painful experience. So what she has to be expressed, because she doesn't understand what is oxytocin reflex, but all of us do understand that if you remain happy, satisfied, if you remain pain-free, mentally and physically stress-free, the breast secretion is very good. And whenever the baby attaches to the breast and tries to suck, there is a reflex, what is called as oxytocin reflex, where you have the neurohumoral reflex, which from the brain, it stimulates or secretes the two hormones, that is the oxytocin and prolactin. So prolactin is responsible for the background secretion of the milk, and prolactin is responsible for the background production of milk, and oxytocin is responsible for that particular milk letdown. So we have to make her allay her anxiety and pain-free. I think that should be all to make her mentally prepared for breastfeeding. And of course, as the discussion goes on, we will discuss whatever details. Thank you so much for the opportunity.
Thank you, ma'am. In case 2, Mrs. Tuma, a teacher by profession, G2P1L0D1 with 20 weeks of gestation, has come with a report of cleft lip and palate. She has undergone amniocentesis and chromosomal anomaly has been ruled out. Now the obstetrician has referred the patient to you to guide regarding postnatal changes, as your hospital has a pediatric surgeon. They want to know about the antenatal preparation, the challenges for feeding, and the time of surgery. Dr. Shweta, can you throw some light on this? And the woman and her husband would be very anxious. They're stressed out after hearing that baby has cleft lip and palate. But still, they want to continue the pregnancy and want to know, first of all, after they have heard the diagnosis, they are very stressed out. So what sort of compassion would you show to them?
Good evening, one and all. Actually, as the case has been already diagnosed, the very first fact I want to do with the patients are counsel them. Counsel about the pros and cons of having a baby with cleft lip and cleft palate. So there is a typical, rather than distorting in a distorting way, I'll just put it a plan. It's in a journal. So there is a plan, ma'am. Actually, there is an exact plan where there's a timetable plan. According to that, we are going to counsel the patient. We have going to support the patient, where we are going to admit them for the support group, and we are going to do a group counseling with the family members, so that to some extent their anxiety will be relieved. The very second thing I want to do is that I'm going to tell them they will have a feeding assistant from birth to the 6th week of birth, post delivery, so that they won't face any of the feeding difficulties. The third one is we will have constant pediatrician monitoring so that they cannot have any stress or anxiety. The very fourth one, I will describe about the cleft lip surgeries when the baby will undergo cleft lip from 6 months to 3 to 6 months, and when they will undergo the cleft palate surgery from 6 months to 12 months. And also I'm going to tell them they will have a healthy baby. They need not worry. They will have constant monitoring. And also I encourage them for going for the breastfeeding. If not exactly with the breastfeeding, we'll have the breastfeeding options. If not exactly with the primary contact with the breast, they can also have breastfeeding.
Next slide, please. Showing the photos.
Breast milk through the bottle cups or specially made breast milk cups or the breast milk bottles that have been specially crafted for the cleft lip and cleft palate babies.
Yeah. Thank you, ma'am. And immediately after the birth, whom would you refer the baby to and why? What will be the whole team consists of as soon as the cleft lip and cleft palate baby is born?
Immediately after the baby is born, I want the pediatrician to assess the baby, ma'am. And then I want them to consult a lactation specialist or lactation consultant.
Yeah, correct. And to help the baby feeding.
Baby's feed.
And later on, what will be the consultant team that you will be referring them to for prosthesis?
Actually, the multidisciplinary team approach is the cornerstone for the management of the cleft lip and cleft baby. In that team, actually, I want to have a team of pediatrician, pediatric surgeon, orthodontist, plastic surgeon, as well as I want to go ahead with the audiologist and the speech therapist, ma'am. Sometime I want to take support of ENT doctor also, ma'am.
Yeah, very well. It is a multidisciplinary action that has to be taken. And we have to be constantly with the patient, supporting them, giving them all the assurances and the emotional support that is required, because they rely upon us more than anyone else. Thank you, Dr. Shweta.
Madam, I have one question, madam. Can you talk something about the prosthesis, obturator, feeding obturator?
About the prosthesis, ma'am?
Yeah.
Actually, it actually closes the cleft and restores the separation between the oral and nasal cavity, ma'am.
Yeah.
So it actually eases the breastfeeding. Like the risk of aspiration pneumonia, that will be less if we have the prosthesis. And before that, we have to consult the patient regarding the prosthesis, its uses, advantages as well as disadvantages.
Correct. Nowadays, like even before the surgery, like they'll be using this prosthesis so that breastfeeding can be made possible for these patients. And can you tell about other anomalies, Shweta, that can affect breastfeeding?
Tongue tie, lip tie, or the other anomalies that is usually associated with the TESMA and which has difficulty in feeding and because of improper latching.
Okay, thank you, Shweta.
Yes, ma'am.
Yeah.
Laita, madam, anything else you want to ask, madam?
Now, experts and chairpersons can intervene if required.
Yeah. Now, how would you, manage this cleft, that tongue tie and the other problem, lip tie? How will you manage?
It is the release of the tongue tie as well as that of the lip tie, ma'am. It's a minor procedure. There is no time limit for it, ma'am. It can be done immediately also, ma'am, like within 6 weeks.
Within 6 weeks, yes.
Yeah, ma'am.
If it is interfering very much with latching, we can do it earlier.
Before 6 weeks, so how will you solve this problem?
Ma'am?
Before 6 weeks, release of tongue tie, you said after 6 weeks only. So before 6 weeks, what is the solution?
Ma'am, if it is immediate, if it is affecting with the baby's feeding, ma'am, that can be tongue tie and lip tie can be immediate. The surgery can be done immediately, ma'am.
Same day? Day 1, day 2?
What that I don't
Maybe
know.
day 3, madam, because 2 days we can take to see whether it is really interfering with feeding. And if we find that it is really interfering, maybe 3rd day we can go ahead with that.
Till then, if there is any, due to any reason, the baby cannot be fed, can be fed with the expressed breast milk with a cup and spoon or with a
Will not be able to swallow, I believe. Baby will not be able to swallow.
Madam, main problem is in latching, madam, because lip tie interferes with upper lip movement and tongue tie with the tongue movements while sucking the milk.
The baby will not be able to swallow, actually.
Yeah.
Even if it is spoon feeding, it is difficult, actually.
Feeding tube is an option, ma'am.
Yeah.
Feeding tube, ma'am.
Okay.
Now
Right.
let's move on to our 3rd case. Here we have a lady, Mrs. Josna. She is a PhD student living with her parents. Because her husband is doing a fellowship in a foreign country. She's a primipara with 2-month-old baby. She has to join her college as she has already completed all her leaves and her exams are very nearby. Her college is 15 minutes from her house. How can she continue breastfeeding with a schedule that stretches from 9 to 6 with travel time of half an hour? She is very clear that she wants to breastfeed a baby. She needs guidance from you, Dr. Hema, in juggling her studies and parenting. So can you please help her?
Yes. Good evening, everyone. Thank you to all the my members for allowing me to give a talk on this small topic of breastfeeding. And this time our breastfeeding, our theme only is how to balance work, how to make breastfeeding work with work is our 2023 theme. So this is a very important topic now. And now because that she has finished all her maternity leave and she has to join back to college, and she being a 21st century mother, she being a 21st century mother, she is now, actually these the mothers are very smart. They are very good in balancing their family also and also their career also. So they don't want compromise in both. Now that she has come to us for seeking her help in how to manage her breastfeeding, it already shows that she is very highly motivated and she doesn't want to stop breastfeeding. That is one quality we are speaking about her. And now she knows how breastfeeding is helpful for her baby and how she is going to manage. And because her husband is not with her, she needs a support group, and her mother is now her support group. And we have to just counsel her that she has to now balance the work and her breastfeeding. And how she has to do that? She has to express her breast milk, and how she can express her breast milk. There are many methods to express the breast milk. One, she can do it manually with her fingers, index and thumb finger. She can do it manually also, and using a manual breast pump she can use, which is very easily available online and very easy to clean also and very easy to maintain also. This online breast pump hardly it costs around 1,500 rupees, which has a pump. And it is very friendly to the patient also. This rubber one is not very friendly, doesn't express much milk. It will consume a lot of her time. And one more option is electric breast pump, which is express large amount of blood and store it, breast milk, and she can store it for a longer duration of time, very quickly in a short duration of. So for that we have, she needs preparation, she needs determination, and she needs good support to achieve this goal of exclusively breastfeeding the baby.
Hema, once you express the milk, how do you store it?
Yes,
Like
ma'am. I'll come to that also, madam.
Yeah.
So, now we have to tell her that she has to set up her own milk bank at her house only. So she can use containers, milk storage bags if are available, and she can use this storage. So there is one CDC breast storage guidelines is there. So the guideline says that freshly expressed pumped milk be at room temperature can be kept for 4 hours. If it is refrigerated, it can be kept for 4 days. And if it is kept in freeze at 0 to 6 months, but it is best to be used 6 months. If she is thawing the, if she is using this, wants to thaw it.
ಏನಿಲ್ಲ ಕೊಡ್ರಿ ಹೇಳಿದಾರೆ ಅಂತ ಹೇಳ್ಕೊಡ್ರಿ ಅಲ್ಲಿರೋ ಡಾಕ್ಟರ್ಗೆ ಬಂದು ಹೇಳಕ್ ಹೇಳ್ತೀನಿ ಆಯ್ತಾ.
Yes, if she wants to thaw that frozen milk, she can have within 1 to 2 hours of
Hema, your voice is not loud. Come little near to the.
Yes, ma'am. Yes.
Yeah, now it's better. Yeah, we
Yes.
can hear.
So breast milk storage guidelines are there. Freshly expressed milk can be kept at room temperature for 4 hours. And if it is refrigerated, it has to be kept for 4 days. If it is frozen at 0 degree temperature, it can be 36, but it is best to use within 2 months only. And if she is frozen milk, she has to use within 2 hours of getting it to room temperature. And in refrigerator, she keep for 1 day. If she is keeping the leftover milk there in the container, and if baby has not drunk that milk and it is leftover, little milk is left over, she has to use within 2 hours itself of that last feed.
So how
Hema, audible. Dr. Hema, could you just be a little more clear? You're not audible.
Madam, come near to the computer, like your laptop, then maybe.
Yeah.
I'm just taking volume, madam.
Yeah.
Fine. Now we can hear you.
Yes, ma'am. Thank you.
Yeah.
So storage, we have to talk about regarding storage also. So how see express milk can be done by herself or by the support care. So that support care is her mother now. So how we have to feed the baby, either with a dropper or with spoon, or she can use bottles also. So she can use cup and spoon also. She can use bottle also with silicone nipple she can use. And how she has to store this milk. So if she has got, she has to first express the milk with the breast pumper. And we have to keep this, we have to follow general tips while we are expressing the breast milk. First, we have to encourage her to wash her hands before pumping and keep the area of nipple and areola clean. She needn't wash it with soap, just keep it clean. And she has to collect the milk in small batches and label them very clearly. The first collected milk, she has to label her time when she has collected, and she has to keep in her fridge at the behind, so that when she is expressing next set batch, she can keep it according to the time which she has collected the breast milk. So these milk she can keep in small containers, either glass containers, which will be very easy to clean and they carry less germ, and which are very easily can be sterilized also. So the time of collection, date of collection should be very nicely labeled and kept it in the refrigerator. And we have to ask her to see that she should not keep it in the door, because repeatedly when we are opening and closing the door, the temperature will fluctuate.
Yeah. Go ahead, ma'am.
Yeah. Repeatedly when we open and close the door, the temperature will fluctuate. So chances of that milk getting spoiled are more. We have to always ask her to keep it in the fridge space, so that the temperature is maintained adequately. So,
Emma, can you tell how you clean the container?
Yes, ma'am. Yes.
Yeah.
Yes, ma'am. I'll come to that also.
Yeah.
Yes. So see, once if she's getting enough break, she has to collect that milk even when she's at workplace also. And when she comes back from her duty, she should always communicate with the care support that she should not feed the baby at least 1 hour prior to she coming back from duty, because she's coming back at 6. She should ask her support person to finish up this expressed milk by 4:35, so that as soon as she comes, the baby will be very excited to see the mother, and mother also will be excited, and that bonding develops between two, and naturally her breast milk will increase secretions, and that bonding between mother and baby also will be kept like that only. And what she has to tell is, we have to tell her support care, this one also, to clean those containers. How she can clean? She has to clean with normal water and 1 soap solutions and sterilize them. If it is glass container, she can sterilize with hot water boil for 10 minutes, clean the container and keep it aside. If she is using already pre-sterilized storage milk bags which are available, then there is no need of re-sterilizing them.
Okay, thank you, Hema. Now she is using all your suggestions and she is able to breastfeed a baby while she's studying. But she also has one more issue. She has got a lot of milk secretion from breast, which wets her clothes, and it is very embarrassing during her classes. Can you give her a solution for this?
Yes, ma'am. So now that she has accessories, she has to carry her accessories, ma'am. How she carries in her purse accessories like comb or basic makeup facilities. Now she has to keep that aside, or she can carry along with that one extra bag where she can have milk pads, she can have, and she can have containers or easy to carry pouches, storage pouches, pre-sterilized pouches, and she can express the milk in between during her break period, or she can use also pads also, and that even her dressing also should be accordingly. She can have with her long maxi gowns, she can have a zip, which can be easily opened with zip, or our Indian wear sari is the best, which will even hide her privacy also, and it looks very elegant also. She can carry herself also very nicely. With the sari also, she can easily cover and express milk in her break places very easily, and get be on time to her classes also. She can use a stole and to cover her, so that in her workplace, in her break time, she can have quickly, she can express her milk and keep it. And if she gets a fridge, privilege of a fridge, then it is actually wonder. Or she can even carry a insulator also, cooler insulator, which can keep the milk cold for 24 hours, but it has to have ice packs, and that ice pack should be kept on the container. So all the 4 walls should have this ice pack, so that the temperature is maintained and the breast milk is very cool and it won't be spoiled easily.
Thank you very much.
Yes, ma'am. And I wanted to add one more point, ma'am. How to check whether the milk, whether she has thought that milk, whether it is really good or whether it is spoiled. So how to check whether she has to give that knowledge also to the support care person, whether that milk is spoiled. Because once the breast milk is kept in fridge, it tends to separate in layers. And once it is separated in layers, it doesn't mean that it is spoiled. It only means that it is having different contents. Only she has to just mix it properly, swirl it around, and just check if it is uniform in nature. If it is uniform in nature, then its quality is good. If it forms clumps, then it means that it is not in good quality. Even she can taste it also and wait for it to come to room temperature, and then she can feed the baby.
Okay. And one more thing, Hema, when you freeze the milk, how do you thaw it? That is also taught.
Madam, if we are not in a hurry, we can just keep it outside and we can wait for it to cool. If it is frozen at 0-degree temperature, we can keep it under a little running water, little warm water. Never we should thaw with hot water. Always keep in warm water, but double method. We can keep a bowl and we can keep a hot warm water and keep the container in it, so that it will liquefy, and we can ready to use for the baby. And we can check the temperature by putting a drop of milk on our forearm and check whether it is warm.
Thank you. Thank you. Thank you, Hema.
Yeah, and one more question. People are very skeptical about refrigeration, and she may say baby will catch cold. How will you counsel her? 2 sentences, because we are already running short.
Actually,
breast milk itself has, we have to tell her that breast milk itself has all nutrients, and it has enough vitamins to improve your baby's immunity. And we are not feeding it cold. We are allowing it to come back to room temperature and then going to feed the baby.
Yeah.
And in this case, there is only 15 minutes journey. During her lunch time, she can come back and feed and go back.
Yes.
There is an opportunity. And there
No,
will be
madam,
feeding time for
because
the
PhD duty. No, madam, PhD students may not get privilege as teachers and lecturers and professors, ma'am. She is a PhD student. That's why I didn't cover that point, ma'am.
9 to 6 class, madam. She cannot leave.
Yeah. Okay. Experts can add to this.
Madam, next question is ready for you.
Yeah. Okay, madam. Case 4. Mrs. Shankrama is a 25-year-old multipara with preterm IUGR twin babies, delivered vaginally. Babies weighing 1.8 at 2 kg. Babies have just been shifted to mother's side from NICU. She has normal breast with good secretion. And how do you plan to feed these babies? Though she has fed the babies earlier, she is worried as they are tiny and also twins. Dr. Jyoti.
Good evening, one and all. Somebody's crosstalk is there. Good evening. Am I audible?
Yes, madam.
Arun sir, can you mute?
Yes, ma'am.
Good evening. Am I audible now?
Yeah,
Yeah.
we can hear.
Here the lady has a late preterm babies. They are twin babies and they are fetal. There could be an element of fetal growth restriction also. So we have three problems to deal with. One is twin pregnancy, one is preterm babies, and another is fetal growth restricted babies. We know that in preterm babies, the breastfeeding reflexes such as rooting reflex, or whether sucking reflex, swallowing, breathing reflex, all those are reduced. So, and these preterm babies cannot successfully finish the breastfeeding. They get tired, they sleep at the breast, and they will not even wake up for the feeds and ask for the breastfeeding. So the breasts are not completely sucked. So what is the thing? The breast milk production works on the mantra on demand and supply. So it is demand and supply. So we have to dupe the breast. We have to tell them, we have to make the breast think that the baby has fed for a longer period, and the rest of the milk which is left in the breast has to be pumped out successfully. Okay, once it is pumped out, and this pumped out milk should be given back to the babies orally or through the Paladay feeds. These are 1.8 and 2 kgs babies. And so when we do this, when you use the pumping and we empty the breast, definitely the milk production also improves. And even though they are twins baby, the breast milk production can suffice even for the twins if they are having good nutrition, if they are following proper position of breastfeeding, they are stress-free, and they know. They of course, in this condition, they need the help of breast counselors who have to guide them. And also at home also, we should counsel the parents, mother, to help them during the breastfeeding. Another very important tool which can be used in these babies are the nipple shield. This nipple shield is a very important tool in preterm also. And not only in sore nipples, even in preterm, because that extra milk flow can be released, can be got from this nipple shield. And also that little rough area of the shield which touches the upper lip will provide an impetus for the baby, or which will stimulate the instinct for breastfeeding. The baby as such will have the instinct for breastfeeding. What we are worried about is the twin babies. Here, the twin babies, there are several positions for the twin babies which we should show them. The normal cradle position, or you can put them under your arms and feed the baby. That is a baseball position, or the crossover position, or the direct latch position. So these all should be supervised when they are in the hospital, and they should be taught about the various positions. And so seamlessly they should feed the babies from both the breast. That is very important. And of course, these type of babies will need some extra things such as galactogogues. Galact is a Greek word which means that milk and gogs are increased production. See, the natural galactogogues, as I said, is all these things they should know. That is the skin to skin contact. That is kangaroo mother's care. We know they are less than 2 kgs babies. They need kangaroo mother's care. That is skin to skin contact for quite some time, and feeding the baby, and keeping the breast empty so that there is increased production of breast milk, which will suffice for both the babies. And frequently on-demand feeding. These babies may not cry for milk. So you should be mentally comfortable and feed the babies, know all the position, eat well, sleep well, drink well. All these are very important. Apart from that, we have so many galactogogues. These oats are there, and these oats contain iron, and iron is supposed to increase the milk production. And you have this brewer's yeast. They are not baker's yeast, they are brewer's yeast, and they also contain so many elements: iron, magnesium, zinc, all those things which again promote the breastfeeding. Flax seeds, we have seen the flax seeds, and these flax seeds contain phytoestrogens and also omega fatty acids, which also promote the breastfeeding. Few examples only. I'm seeing so many lists here, and you can also get this barley. All these are very commonly used. That's why I'm telling. And this barley, they increase the prolactin level, and hence there is increased production of milk. So these are all very, very important in breastfeeding the twins. And what other element which I told is very preterm and FGR. What is the problem here? Very preterm deliveries are in the NICU, they are on IV fluids, and in these patients, when as soon as a baby is fit, we have to express the breast milk and tube feeding. And then whatever said and done, breast milk is the best. So the same breast milk can be fed through the tube feeding, and then once the baby gains weight, and then you can be shifted to the direct breastfeeding. So there are some separate special preterm formulas for very preterm births. Another for fetal growth restricted babies, what are we worried? GI adaptation. So necrotizing enterocolitis. So they are started on enteric feeding, but again you should balance between the enteric feeding and the breastfeeding. So minimal early enteric feeding. Soon you should shift over to the breastfeeding as early as possible, and when it is deemed fit, and we should follow the protocols of the breastfeeding properly. And when you are advancing the feeds, you should be carefully advancing the feeds because of the risk of the necrotizing enterocolitis. So once you follow all this, you should allay the fears of the twin lady. Initial days are difficult for her, but if we counsel her nicely, tell her all these positions, and using the pump, using the nipple shield in late preterms, we can tide over the crisis.
Yeah, ma'am. Proceed with the next case.
Okay, now we have Mrs. Renuka, who is 28-year-old lady. She has undergone left-sided radical mastectomy for CA breast. She has completed her chemo 2 years back and is now pregnant. She is very keen on breastfeeding her baby, but she is also anxious to know if it is possible and feasible. Dr. Nagratna madam, can you please enlighten us how to counsel this patient and what are the pros and cons of breastfeeding in this patient?
Good evening, everybody. Yeah. In this case, this patient, she has undergone surgery. And she has even completed her chemotherapy. That too 2 years back. So now she is capable of breastfeeding the baby. There is absolutely no contraindication for breastfeeding. And the very fact that she has chosen to breastfeed is good both for her also and for her baby. For the baby, because baby is getting a breast milk and getting all the advantages of breastfeeding. And for her also, she has already developed CA in the one breast. So this breast will be protected if she is breastfeeding. So we advise her to go ahead with the breastfeeding. There is no problem with breastfeeding. And only thing is, suppose the mode of treatment, if the patient was diagnosed as CA cervix at that time, postnatal period, then definitely we don't advise her to go for breastfeeding because we may have to go for surgery, and the breast enlargement, the vascularity, everything during breastfeeding makes the surgery more difficult, and also the chance of infection, all those complications will be there, and it can increase the size also. But now in this case, she has undergone surgery, so she can very well breastfeed the baby.
Madam, any precautions to be taken in this patient? Any counseling, extra counseling to be done in this patient?
But we have to monitor the patient, because if she has developed CA in one breast, there is chance that she may develop CA in this breast also. So the periodic monitoring condition of the breast is very important. We have to follow up, and preferably if we should check for the hormone sensitivity, and if the patient is on hormone therapy, preferably we should not advise breastfeeding.
Is there any safe interval between the surgery and to become pregnant, madam, once the patient is CA breast patient?
Between surgery and breastfeeding, there's nothing much because post-surgery, once the breast is normal, healing, everything is completed, she can go ahead. But if she's undergoing chemotherapy, because during chemotherapy, definitely she'll not be breastfeeding because breastfeeding is contraindicated because anti-cancer drugs should not be given during breastfeeding. But these anti-cancer drugs have long half-life. So it depends on individual drugs. So some drugs may have half-life of few days, some few months, so like that. So depending on the type of drugs what we are using, so we have to give time limit for the initiation of the breastfeeding. Otherwise, we can start the breastfeeding.
And if the patient is on something like tamoxifen for a longer time, should we stop when she becomes pregnant?
No, she should not breastfeed.
Should we stop the drug or we should tell her not to feed?
It depends. We have to check for the receptors, and if the patient needs tamoxifen, we have to stop the breastfeeding. And if the patient is not dependent on tamoxifen, they can discontinue tamoxifen and go ahead with the breastfeeding.
So it depends on hormone receptivity of the CA. Okay. Okay, madam. Thank you. Now
And
let's
one more
move.
thing I want to tell is, suppose she may also require radiotherapy. So following radiotherapy, so that side breast preferably it should not, because surgery, if it is a radical mastectomy, that breast is removed. But whereas in radiotherapy, that breast will be there. So she should not feed from the breast which has undergone radiotherapy. So she can feed from the other breast.
Dr. Shobha, there was one more question for me in your panel, that previously breastfed babies, what are the bottle-fed babies, what are the problems? There could be nipple confusion in these because they're already, and then what happens is the muscles which are used for breastfeeding is different from for bottle feeding. And again, nipple sheet could help, I feel, and refusal to take feeds, all those things.
They say even nipple shield causes the same nipple confusion, madam. That is what pediatricians say. So even for nipple shield.
Okay, for this refusal, but they say at least because of it's better, you can try, I have heard. So it is already
okay, madam.
Told
so
it is not.
Just I want to add a point there. So last week only we had a breastfeeding workshop for 4 days. Actually, it was done by Breastfeeding Friendly Hospital Initiative. So that group, it was one wonderful workshop we had. So there they were insisting no rice tube feeding, no spoon feeding, no this thing. So their advice was to go directly with the cup feeding, and they demonstrated, and we have now started doing that cup feeding so beautifully. Even the so much premature IUGR baby, chota, they look so fragile, but so nicely they'll be sucking the milk. And I think it's better to go ahead with the cup feeding.
Yes, Dr. Nagaratna, you are very, very correct. In fact, even if first of all, for this case, I would say, even when the babies are a little premature and their weight is quite good, but the moment you evaluate the babies, you see that the suck is good. And, as soon as the baby is delivered, what is the success of breastfeeding to be successful is the early initiation of breastfeeding. And once the pediatrician or the neonatologist says, okay, with rest of the problems, I think that's the best time to put the babies to breast, as all of you have discussed how you should hold and how you should attach all these things. But what Dr. Nagaratna has said is very, very true. Absolutely no bottle, no syringe, and nothing, even no pacifiers as well. Breastfeeding, that is directly attaching the baby to mother's breast. I think that is the best. There should be no argument on this. And I appreciate Dr. Nagaratna. She's very discussed it in depth.
Thank you, ma'am.
Hello,
And a few more things.
can I
just
say one
wanted to
thing?
highlight.
Madam, can I say one thing?
Yeah.
I'm Dr. Nagaratna. See, one more thing is the painful nipples are mainly due to faulty attachment. That should be taken care. The lactation specialist should teach them how to latch, the latching
Have that case, madam.
position is very, very important. Otherwise, otherwise they don't get nipple pain at all. They should not get unless there is a faulty technique in latching. So that should be made clear to the patient how to latch onto the nipple, so that she will not have pain and all these problems can be taken care.
Okay, madam. Thank you.
And a few more of our misconceptions were resolved there. Like we had that this thing during the antenatal period, any retracted nipple, flat nipple has to be corrected. So they were very much against that. So there's
Yeah,
no.
that's what I described.
Yeah,
when
yeah,
I
madam,
talked
that's
about it,
that point.
that the
Yeah.
baby attaches to the breast
Yeah.
of the mother and not to the nipple. So whether it is flat or inverted nipple, it doesn't make any difference. You just teach the mother for the proper or the effective latch. And I just go a step ahead to discuss that if at all the baby is having mouth open, you can just straightway put the nipple and the entire breast inside, so that the baby, attaches properly with the upper arch of the, upper jaw to the areola of the mother's breast. That is how it is. If the baby is not opening the mouth, what you have to do is just touch with the nipple to the baby's nose, so that the baby opens the mouth widely, and then you put the breast straight inside. So I think there's no alternative for effective latch of the baby, what everybody is talking about. So we should not use the nipple shield and whatever other means. Try and, encourage the mother for proper and effective latching. That is the key to success of the successful breastfeeding. Early initiation, effective latching, complete and frequent feeding. And what you are talking about, because of the pulling of the nipple, syringing of the nipple, tying threads and on, applying pumps, it makes all the more painful. And as we have been talking about, the oxytocin reflex gets suppressed or hindered by the pain which she is facing. And that is why we are insisting that it should be a joyful experience. So make her pain-free and encourage her for breastfeeding directly on her breast. Thank you.
Yeah, we were actually using this syringing even for the flat nipple. So they were very much against that. For a flat nipple, syringing should never be used. It's the misuse of syringing. So only for a retracted nipple, that too only after deliveries, that should never be attempted in the antenatal period.
Lalita, madam.
We'll move to the case 6. Mrs. Reshma is a primary para delivered 20 days back. She has come with complaints of severe nipple pain and inability to feed the baby. She looks distressed. She is also worried as her baby is not gaining enough weight and cranky. On examination, her nipples are severely damaged and inflamed. How will you evaluate and manage this case? Dr. Jyoti?
As Sneha madam has been telling, the problem here is latching and good position. These two things you have to look into. Latching, we should teach them, as madam was telling, bring the baby to the nipple and the baby will automatically, that reflex will get initiated. And with your other finger, hold the nipple, rub the nipple to the upper lip, and the baby's mouth opens, and it should be the chin which should touch the breast. Yeah. That means to say the depth, it has gone inside and it has latched. And the typical suck, swallow, breathe, and with both the upper and the lower lip everted. So we should teach them when they are in the hospital proper latching method. And the other thing is proper positioning is very important. The various positioning are there. And so you should teach them whatever position, whether it's cradle or side sliding or laid back or a football, whichever it is, they should know the proper position, and latching method should be initiated before you discharge the patient. So what would happen sometimes because of the eruption of the teeth or something? So there could be a problem, and there could be some damage to the skin gets eroded like that. Then they're very, very painful. Then it is sore or cracked nipples, or there could be some infection also, dryness, or poor latch is of course very, very important. So the most important is you should teach them to latch and all the conservative procedures, wear a supportive bra and give some pads, hydrogel pads, if it is because of difficulty in latching, the breasts may be congested. So you should see that the breast congestion is ruled out, engorgement is not there. There's any thrush, you have to treat the thrush. And if there is any problem in the sucking, there could be tongue tie, frenulum, all those should be tackled.
Okay. And now what are the, Madam has explained what are the points of good latching and how she should check the latching also.
Most important is the nipple shield, madam. Nipple shield is very important in this, because by the time you are treating this, the establishment of the breastfeeding should continue. It's very painful for her. Through the nipple shield, you can continue the establishment of breastfeeding. Meanwhile, you are treating her for the, it will get healing of the sore nipple.
No. Yeah. Dr. Hema, poor latching results in sore nipples or cracked nipples. Now, what are the complications of these sore nipples? What it can cause?
And first of all, the woman refuses to feed because she is,
yes.
It is very painful.
Yeah.
And that bonding between mother and the child is cut off, and she no more enjoys breastfeeding. Yes. And breast engorgements, then infection, secondary mastitis, breast abscess, and again further complications because of breast abscess. We have to, again, if she has had a surgical intervention and she has had drainage of breast abscess, then continuous dressings, very painful dressings, and no more that postpartum period will be joyous for her, madam.
Yeah, and
So
stress and guilty for unsuccessful feeding when for a lifelong period.
Main concern is whether she'll be able to feed again after that. Either even physically also she feels little deprived, and even mentally also she'll be not ready to take the baby and ask allow it to breastfeed. So first of all, I think if we can avoid this complication right from the beginning itself, by good in the first step itself. So right latching, and very simple of, instead of explaining her how complicated it is, just we have to see if the baby makes sound. So when babies, especially new mothers, we have these problems. Yeah. So we just ask whether the baby makes, very simple, we can counsel her how to find out whether the baby is drinking milk properly or no, whether it is latching properly or no. If it makes sound when it is feeding, then it means that it is not, latching is not complete, or it is improper latching. And if the nipple, if it easily slips out, if little she changes the position, if the nipple slips out easily out of the baby's mouth, it also says it is, latching is not proper. If she notices these two things, she has to again rectify with the help of seniors or her elders relatives, or she can go to a consultant, lactation consultant, and rectify her problem. Correct. Or any senior staff nurse also will help her out with the feeding technique, which is improper latching technique.
Yeah,
and
she's likely to switch to bottle feeding and all other feeding, feeding other milk and all. Which will
here we have a traditional method of massaging their breast with massaging their body with oils also. That also will help her in case she has sore nipples. In the early stages, it will help her to hydrate her this one. We can always ask her to moist her the nipples with a moist warm heat she can use before feeding. And post feeding, if she has little soreness, instead of having cracked nipples and going to that last stage, she can immediately use cold compresses after the feeding to relieve make it very soothing. Her nipples very soothing, madam.
Yeah, very
nice. Can I just make one point here? As we have been discussing the cracked nipple, it's a result of faulty latching. That is what everybody has agreed to it. Only one comment here on the cracked nipple, that is not to clean or wash the breast and the nipple, rather not even frequently, but not even once or twice. Whatever bath you have, that is all for hygiene. She should not wash and dry her nipples. In fact, what is advised here is let the babies, let the baby feed and let the nipple be wet with the mother's milk as such. Mother's milk, if you just allow air dry, that should be the best soother and the healer for this. In fact, application of many creams is not recommended. That is what the take-home message here.
Madam, applying the milk itself is antibacterial and it has
Hind
got
milk.
Yes, that is what I'm trying to tell you, that just keep the milk as it is. Don't clean, don't dry. Let it be as it is. Let it air dry. That's all. Thank
And
you.
one more point is if she stops breastfeeding before that suction, she will break the suction. Before she stops breastfeeding, she is in a hurry, she wants to get up and go. She has to break that suction, then the baby will leave that grip. And then that chance of sore nipple and cracked nipples are very less, madam.
Perfect.
So now we move on to our last case. Here we have Mrs. Manjula, primipara with eclampsia. She was delivered by LSES. She had another convulsion on day 2 despite receiving Maxel. So she's put on multiple anticonvulsants. Baby was shifted to NICU for birth asphyxia. Baby is being shifted to mother side on day 3. But pediatrician is little apprehensive to shift to mother side. Madam, how will you convince pediatrician to shift to mother side, and how you will be seeing breastfeeding is initiated in these high risk patients? Dr. Nagratna, madam, over to you.
Yeah, thank you, Shobha. So here we have got 3 risk factors. One is it's a case of eclampsia. So that has got some effect on the breastfeeding. Second, she is not a normal delivery, cesarean section. So initiation of the breastfeeding in cesarean section, that is a second issue. And the third one is she is on drugs, anticonvulsant. She is on Maxel, she is on Levipil and all those things. So as far as initiation of the breastfeeding, this should have been initiated in the OT itself. Now we have started that initiative. So one side obstetrician is suturing the uterus after delivering the baby. The anesthetist is helping to initiate the breastfeeding. So even if nothing is coming, the first early skin to skin contact is definitely going to help, and with little bit of help, the baby is able to suck. So we have initiated the breastfeeding very early. So that is one very good thing. So after that, due to whatever reason, if the baby is shifted to NICU, because now the pediatricians are very much willing to promote breastfeeding. So it is not difficult to pass. It is not the question of persuading. They themselves will be willing to initiate breastfeeding unless the baby has got some problem. They'll be able to send the baby to the mother side, because now the mother cannot be transferred to the NICU because she is undergone cesarean section. So that is not a problem.
Patient is in ICU, madam, and she is still not fully conscious. That's why they are worried.
Even if the patient is not conscious, even if the patient is drowsy also, we can take care of either patient's attenders or the nursing staff. They can hold the baby and they can do the breastfeeding till the patient become conscious or till the patient is able to sit up. So we can still continue with the breastfeeding. It is possible, but it needs a proper monitoring.
What is the best position for breastfeeding in these patients, madam?
So when we initiated the breastfeeding in the OT, so the patient will be in the supine position. So the anesthetist will be holding the baby in such a way that the thumb will be behind the back and the 2 index fingers will be on either side of the chin and the 3 fingers will be on the chest. So the baby is fixed. So there are 4 points in breastfeeding. The baby should be in a straight line. It should not be tilted, head turned to one side, body to one side. That should not be there. So the whole fetus should be in one line and it should be close to the mother's breast. Okay. So from the side or over the shoulder, that they can take the baby to the breast and they can initiate the breastfeeding. So that is in the OT. So in the post-operative ward, when the patient is still semi-conscious or still she is drowsy, so the nursing staff can take the baby and they can feed. Or if the patient is not that much drowsy, she can turn to one side, means the patient can be turned to one side and the baby is put on the side and the breastfeeding can be continued.
So side lying and laid back positions.
Yeah, I think here only one point I would like to differ, that in the OT, we will not engage the anesthetist for breastfeeding because he has to monitor the patient. So what we have been following years together, maybe last 5 years I have been practicing in my own hospital, is our staff who, takes care of the baby, she will hold and she will help the mother out for breastfeeding.
Yeah, definitely,
Take
madam.
care of the
Nursing
baby
staff
as
also
well.
can do
Yes,
that.
yes. And
Yeah.
of course, sideline is position that is the best, but whatever position is comfortable for the mother as well as the baby, and how Dr. Nagaratna said, the baby should be in a neutral position, body and head should be in the same plane, I would say, and not the tilted one. So that should be all.
Madam,
And the third,
is there any concern because of multiple drug usage?
yeah,
at
that
the-
is what I'm coming to that. So the patient is on anticonvulsant, she is on Maxalt, she is on Levipil. So absolute contraindication is not there for any of these drugs. So the only absolute contraindication what they are telling is it should be any anti-cancer drugs or radioactive drugs, or it is some abusive drugs like cocaine or anything like that. Otherwise, we have to balance between whether the mother is really needing that drug or not, because the advantages of breastfeeding outweigh the side effects of the drugs. Okay, if at all possible, we can change the drugs in the mother, but if the mother needs the drugs, so you continue the drugs and you continue with the breastfeeding. So that is the concept.
Perfect. Only one more addition here. Change the drugs which is lesser,
Lesser toxic.
hazardous or toxic to the baby. That is one. Adjust the dosage of the drugs in such a way that you feed the baby and then you give the dose. That's how.
Yeah.
So you
After the
try
feeding,
to
we can give
minimize
that right.
Yes. Yes.
Thank you very much, madam. So
Thank
now
you.
come to the end of our panel discussion. It was a very wonderful discussion talking to you all and taking your ideas and making breastfeeding work for everyone. Laita madam, please tell your inputs.
Yeah, it was a wonderful panel discussion. Even I learned a lot from this, even though it was prepared. So thank you, everybody. Thank you, all the panelists and Shobha madam for a wonderful panel discussion. Now, closing.
Hello. Yeah.
Madam, could I just add?
Hello.
Dr. Vidya Taube.
Hello.
Yes, ma'am.
Madam, before we wind off, I think one important thing is a challenge to we obstetricians.
Hello.
Because we've been probably a bridge between the lactation specialist and also the parents or the attenders. So basically, I think the first important thing is we need to actually give a little bit of time during our antenatal checkups when they come, right from examining a breast, because nowadays we are seeing a lot of cases with mass in the breast lumps, which is quite tension for the family, as also the myths, what we actually followed in the postgraduate days, and now the era is changed, as Dr. Sneha and the other panelists were also voicing out, that we're not doing the syringing anymore. The concept of the, irrespective of whether it is an inverted nipple or what is it, the education should start from the antenatal checkup. I feel, because nowadays I had actually seen a case of psoriasis, which she had given up that she will not be able to feed or latch anymore. So I think we need to give little prominence during the antenatal checkup as well as during our rounds with postnatally, 2 or 3 minutes how the latch is on. And that probably will solve the entire solution and the bridge between the parents and the pediatricians. And thank you so much, ma'am. It was a wonderful panel. And the moderation was excellent. The questions were very practical and the answers also were very convincing. There was no much of the questions in the chat box. If there's any other questions, we can give a minute for the questions to take up. Vidya madam is already set for surgery, I think.
Just
Madam?
finished one cesarean, but I was listening to you.
Okay,
Just
madam.
finished one section and came out. Yeah. I think
I think we are
chat box, very good messages are coming. Practical questions, good moderation, everything. Expert comments by Sneha, she has given already.
Yes.
Thank you very much.
I have tried.
Yeah,
to,
I think,
tried to give my inputs then and then. I think a little bit of additions. whatever, I just want to say from my side that as breast committee chairperson, almost, my tenure extended from 3 years to 4 years. And then we have carried out for more than 600 programs, including physical as well as virtual. And we have tried to reach all the societies all across India. What we have been doing is almost 4 breastfeeding weeks, and throughout the year we had continued this activity. And for this, we have tried to, sensitize our Foxians, because all of us are ourselves not very well aware of all these, the breastfeeding practices, what are the recommendations by WHO, UNICEF. So we tried to go ahead with the CMEs, and we came up with the regular ready reckoners, as well as, some of the newsletters. What is the global scenario, and what is the global scenario and the Indian concept as well? What is the situation at present? So all this we came up as 2 newsletters by our committee, and also we tried to, promote breastfeeding at every level. Of course, we trained our paramedics as well, and we tried to make awareness in the general public. So at all the 3 levels, we tried to work. And as Dr. Nagaratnam was talking about, towards the end of our tenure, we had to come up with a module what is called as Saheli. It was for the training of the nurses or paramedics, and here they were given the actual knowledge what is required, and the demonstrations as well in the form of video recording by the experts in that particular regional languages. And we had almost 12-13 languages, those languages videos we have recorded by the experts. So we have tried to cover almost 40,000 nursing homes. We have covered with this, some of the pharmas, they have taken up this initiative all over India, including the smaller nursing homes we have tried to reach. So I think now by this time, looking at today's panel discussion, I'm really happy that all of you are so much interested and, full of knowledge about breastfeeding. So this is really very, very satisfying for me. Thank you so much, Dr. Vidya, for giving me.
Yeah, that is a mammoth work. That is a mammoth work. I feel that is the best work all these years the Sneha has put in.
Thank you. Once again, I thank all of you for having me here, and of course, giving me opportunity to share my views. Thank you so much.
Thank you.
Yeah, I think we must thank Sneha for her expert opinion on this, and she's really done a lot in the last 10 years, and I think because of that, lot of awareness has been created. And in our college also, every year, along with the Young Infant Feeding Society, Dr. Banapur Math comes every year to do the workshop on breastfeeding practices. He was the one who initiated this breastfeeding practices in Karnataka and took everywhere, and along with Nirmala Kesari from JJM Medical College. So they did a lot of field work, and they done, and he comes always to our college to do a program, and we do a long 1 week breastfeeding program in our department along with pediatric team. So that was very nice, and this panel was really excellent, and they covered some of the unusual practical problems rather than the usual ones. So that was really wonderful, and thank Lalita for giving such a wonderful panel discussion, and all the panelists were really did a good job. And I think I thank Asoka, both the Breast Committee as well as the Safe Motherhood Committee, and our President, Dr. Vidya Tobi, for giving us an opportunity to chair this wonderful session. I'm always there for this breastfeeding, anything concerned with breast and breastfeeding, being ex-chairperson of this committee. Thank you.
Thank you very much, madam. Moving towards an official vote of thanks by Dr. Shobha. I think the days to go ahead, we will have babies which will voice out to their mom saying that, mother, you rest if you must. Quit.
ಇನ್ನು ನೆಕ್ಸ್ಟ್ ಅನಾಮಲಿ ಸ್ಕ್ಯಾನ್ ಅರ್ಲಿ ಅನಾಮಲಿ ಸ್ಕ್ಯಾನ್ ಮಾಡ್ಕೊಳ್ಳೋವರೆಗೂ ಒಂದು ಇಂಜೆಕ್ಷನ್ 15 ದಿವಸಕ್ಕೆ ಒಂದ್ಸತಿ ಪ್ರೊಲಿಟಾನ್ ತಗೋ, ಬಿಕಾಸ್ ಅದು ಇನ್ನು
Yes. So,
Madam, shall I?
Is in our clinic.
Yes, yes. Days to come, then we will have babies voicing out, saying that "Doctor, rest if you want to rest, but don't you quit breastfeeding. I need some, and I need more." With this note, I want Dr. Shobha to officially thank the entire audience and the panel and the moderators. Over to you, Dr. Shobha.
Thank you, Sonia, madam. After this wonderful session, I would like to thank Dr. M.G. Hiremat sir, first of all, for creating the committees in Kasoga so that all of us get involved and work, and also always inspiring and encouraging us, all youngsters, to come ahead and do these programs. Thank you very much, sir. You are a guru par excellence, and your inspiration and your work will stay forever. I'd also like to thank Dr. Vidya Tubbi madam, our dynamic president, for pushing us to do this program. Thank you, madam, for giving us this opportunity. And my heartfelt thanks to Dr. Rajeshri Paladi madam, our secretary, for always supporting us in whatever we do. Thank you very much, madam. And also my heartfelt thanks to Dr. Suman Gaddi, Treasurer, Kasoga. I'm very grateful to Dr. Sneha Buyar madam, past chairperson of Breast Committee, for attending the whole session and giving her pearls of wisdom. Thanks a lot, madam. I also want to thank Dr. Sonia Mandappa, who is the advisor of both the committees, for beautifully convening the program. Thank you, madam. And I would like to thank Dr. Nagratnama madam, past chairperson of Breast Committee. Thank you, madam, for your words of wisdom. And I also thank my co-moderator, Dr. Lalita H.S. madam, for accommodating me and being supportive. Thank you very much, madam. It was great working with you. And I would also like to thank all the panelists, Dr. Nagratna madam, Dr. Jyoti G.S. madam, Dr. Veena Bhatt madam, Dr. Shweta and Dr. Hema, for so beautifully giving your ideas and your sharing your knowledge. And I thank all the delegates who stayed up late and attended to this session. And at the end, I would also like to thank for Mr. Arun for giving us technical support. And at the end, but not last but not the least, the sponsors of this program, Pharmanova Company, whose product is Vinamic, which is a very good galactagogue and improves breast milk production significantly. Do use the product and support them. And at the end, I would like to say, breast milk is the best milk for the baby. Let us make it work for all sorts of women, and let us support breastfeeding so that we improve the society and improve both the maternal and fetal and neonatal outcomes and make a healthier society. Thank you, one and all.